Imagine waking up one morning, looking in the mirror, and noticing a tiny spot on your skin, something you've never seen before. Maybe it's a strange mole, maybe it's a small bump that doesn't heal. You ignore it for a week, then a month, and suddenly, that small, harmless spot turns into something much more dangerous. In the United States alone, skin cancer is the most common cancer, and yet most people don't even realize they have it until it's too late. But here's the good news: skin cancer is also one of the most preventable and treatable cancers. If you catch it early. Reasons. Causes of skin cancer. Skin cancer develops when abnormal skin cells grow uncontrollably due to damage in their DNA. This damage typically comes from exposure to ultraviolet UV radiation, but the process is influenced by many different factors. Understanding these causes helps you protect yourself and recognize risk early. The biggest and most significant reason behind skin cancer is UV radiation from the sun. The sun emits UVA and UVB rays, and both can damage the DNA inside your skin cells. UVB rays primarily cause sunburn, while UVA rays penetrate deeper and lead to long-term skin damage, aging, and cancer formation. People who spend long hours outdoors without proper sun protection, construction workers, delivery drivers, farmers, or beach lovers are at higher risk. Even short, intense bursts of sun exposure, like during vacation tanning, can cause lasting cellular damage. Another major reason is tanning beds, which are extremely dangerous. Many people mistakenly believe tanning beds are safer than natural sunlight, but studies showed tanning beds expose the skin to concentrated UV radiation, significantly increasing the risk of melanoma, the deadliest type of skin cancer. In fact, indoor tanning before the age of 35 increases the risk of melanoma by as much as 75%. The UV exposure from tanning machines is often stronger than midday sunlight, making it even more harmful. Genetics also play an important role. If skin cancer runs in your family, especially melanoma, your risk automatically increases. This doesn't guarantee you'll develop skin cancer, but it means your skin may be more sensitive to UV damage. Certain inherited gene mutations also weaken the skin's natural ability to repair damaged DNA, making sun exposure more dangerous. Another major reason is fair or light-colored skin. People with light skin, freckles, red or blonde hair, and light eyes have less melanin, the pigment that protects skin from UV rays. Less melanin means less natural protection, which increases the risk dramatically. However, skin cancer can affect people of all skin tones, including dark skin. The difference is that, in darker skin, melanoma often goes unnoticed longer and appears in areas not typically exposed to the sun, like the palms, soles, or under the nails. A weakened immune system is another important factor. People who've had organ transplants, those undergoing chemotherapy, people living with chronic illnesses, or those taking long-term immune-suppressing medications are more likely to develop skin cancer because their bodies cannot efficiently repair or eliminate damaged cells. Symptoms. Skin cancer symptoms vary depending on the type: basal cell carcinoma, squamous cell carcinoma, or melanoma, but many warning signs overlap. The key to saving lives is early detection, so recognizing these symptoms is critical. Let's begin with basal cell carcinoma, BCC. The most common type. BCC usually appears on sun-exposed areas like the face, neck, ears, scalp, shoulders, and back. The symptoms often look harmless, which is why many people ignore them. You may notice a pearly or waxy bump, sometimes pink, beige, or slightly translucent. These bumps may bleed easily, especially during shaving. Another sign is a flat, scar-like patch that feels firm and may be white, yellow, or skin. Some BCCs form a sore that doesn't heal, heals temporarily, and then reopens. Persistent bleeding, crusting, or irritation is a major warning sign. Next is squamous cell carcinoma, SCC, which often appears as a rough, scaly patch that may crust or bleed. It can also look like a firm, red nodule. SCC usually appears on the face, lips, ears, hands, arms, and legs, areas frequently exposed to sunlight. Sometimes it develops inside scars or burns. A classic symptom is a painful or tender bump that keeps growing. Another sign is a thickened, wart-like growth that doesn't go away. If SCC develops on the lips, it may cause persistent dryness, cracking, or a rough patch that never heals. Now let's talk about the most dangerous type, melanoma. Melanoma can appear anywhere on the body, even in places not exposed to sunlight. It often begins as a new mole, or changes in an existing mole. To help people recognize melanoma early, doctors use the ABCDE rule. A. Asymmetry. One half of the mole doesn't match the other half. Border. The edges are irregular, blurred, or jagged. C. Color. Multiple colors appear in one mole: brown, black, red, blue, or even white. D. Diameter. The spot is larger than 6 millimeters, about the size of a pencil eraser, though melanomas can be smaller. Evolving. Any change in size, shape, color, texture, or height is a red flag. Melanoma can also be itchy, painful, or bleed easily. Some people notice a dark streak under a fingernail or a toenail. This is called subungual melanoma. On darker skin, melanoma often appears on the palms, soles, or under the nails. These spots may look like bruises, but don't fade with time. Another important warning sign is a new spot that looks different from all your other moles. This is called the ugly duckling sign. If one mole stands out, get it checked. Other general symptoms of skin cancer include a sore that doesn't heal within 3 to 4 weeks, persistent itching or tenderness, a growth that keeps increasing in size, a mole that becomes raised or develops a lump, a patch of skin that changes texture, unexplained bleeding or crusting, changes in pigmentation. Advanced skin cancer may cause swollen lymph nodes, pain in nearby areas, fatigue, unexplained weight loss, rare but possible in advanced melanoma. Treatment to skin cancer. Treatment depends on the type, size, depth, and location of the cancer. The goal is to remove or destroy cancer cells while preserving healthy skin. The most common and effective treatment is surgical removal. For many basal cell and squamous cell cancers, doctors perform a simple excisional surgery where the cancer and some surrounding tissue are cut out. This method has a high success rate and often leaves minimal scarring. For cancers in delicate areas, like the face, nose, or ears, surgery is the gold standard. In most surgery, the doctor removes the cancer layer by layer, examining each layer under a microscope until no cancer remains. This method preserves the maximum amount of healthy skin and ensures the cancer is fully removed. It's especially effective for recurring or aggressive tumors. Another method is cryotherapy, where the doctor freezes the cancer cells using liquid nitrogen. This damages and destroys the abnormal cells. It's typically used for very early skin cancers or precancerous lesions like actinic keratosis. Radiation therapy is an option for people who cannot undergo surgery or when the cancer is in a difficult location. High-energy rays target and destroy cancer cells. Radiation is often used for older adults or for cancers on the nose, ears, or eyelids, where surgery may cause cosmetic challenges. For advanced basal cell carcinoma or squamous cell carcinoma, doctors may use topical medications such as imiquimod 5. These creams stimulate the immune system or kill cancer cells on the skin's surface. They're effective for superficial cancers that haven't grown deeply. When it comes to melanoma, treatment depends heavily on how early it's caught. Early-stage melanoma is removed surgically and usually has an excellent prognosis. But if melanoma spreads to lymph nodes or other organs, treatment becomes more complex. If you found this video helpful, make sure to like, share, and subscribe to the channel. Your support helps us continue spreading life-saving health information. Thanks for watching, and stay safe in the sun.